Okay, hang on. Okay.
Hi, I am here today to talk to you about butterflies. Not the kind that one may find in nature, but Turner syndrome, or TS butterflies. The butterfly is such a perfect symbol because, as you will learn today, like the butterfly, TS ladies are fragile, yet strong. How many of you have ever met a female with Turner syndrome? Well, every one of you in this room should have their hands up because I have Turner syndrome. Have any of you ever heard of Turner syndrome? Don't worry, I had not either until a couple of years ago. Turner syndrome, TS, is a chromosomal condition that describes girls and women with common features that are caused by complete or partial absence of the second sex chromosome. Turner syndrome impacts and encompasses nearly every body system, causing a wide variety of issues ranging from short stature, ovarian failure, heart issues, nerve to skin conditions, and even autoimmune diseases. Tackling the topic of Turner syndrome is a confusing experience for a novice because it is so multifaceted. As a person with Turner syndrome, the confusing, hectic ride that is Turner syndrome is my life. Realize though, not every Turner woman is the same. There are many differences between each one. Throughout this speech, examples of people with Turner syndrome will be provided. The examples will hopefully provide clarity and valuable information to the understanding of Turner syndrome. Back in the day, 1938 to be exact, Henry Turner discovered a group of females with the similar traits of short stature, webbed neck, cubitus valgus, or arms turned out at the side, and lack of sexual development. The cause of this genetic disorder, only found in females, is when all or part of one of the X chromosomes is lost. Nothing can be done to prevent this from happening. A karyotype is a study that shows the chromosomes present in a cell. It gives a picture of the chromosomes, and as you can see in this slide, the normal karyotype contains 46 chromosomes for a male and female. A female has 2 X chromosomes, and for a male, 1 X and 1 Y. So in the farther over one, you can see that it forms an X, and then over here, that's the male one, and it doesn't. There are many types of Turner syndrome. The types are classified by the defectiveness of the X chromosome. One type is 45X, which is called classic Turner syndrome. This is shown in the picture. Classic Turner syndrome encompasses 50% of all females with TS who are missing an X chromosome in every cell that is tested. The type that I have is a mosaicism, meaning I have more than one cell type. So some of mine will look like that, while others will look like a typical female one. This occurs in about 30% of females with TS. In my case, my karyotype is 46XX, 45X, meaning I have one normal cell line and another that is missing an X chromosome. This type may have less of an effect on the women with it, so it is harder to recognize and has fewer symptoms. In others, the second cell line has a structurally abnormal X chromosome. The number of Turner girls who live to be born is less than 5%, meaning that more than 95% of Turner syndrome babies do not survive through birth. This leaves the 1 in 2,000 females born who share the condition to tell the tale and mourn their Turner sisters. 10% of all miscarriages in the U.S. are because of Turner syndrome. 70,000 women, girls, and babies with Turner syndrome live in the U.S. For those who beat the odds, it is a long and difficult road. Many women with Turner syndrome live challenging lives because of several different possible symptoms that are correlated to this disorder. Examples of possible symptoms are short stature, gonadal dysgenesis, also known as ovarian dysfunction, heart issues, abnormal kidneys, autoimmune diseases, other endocrine disorders, learning disabilities, physical appearance differences, sensory issues, and a long list of others that could bore a person to sleep. but are also of great importance. Beginning with short stature, here's a rundown of potential connected disorders and possible treatments. Short stature is a problem for virtually all individuals with Turner syndrome. Most women with Turner syndrome are about 20 centimeters, or about 8 inches shorter than their peers, as well as their projected parental height. Most Turner women's adult height only gets to about 4 feet 7 inches to 4 feet 10 inches. When diagnosed at a young age, using growth hormone can treat short stature and will improve height by a couple of inches. Combined with ovarian dysfunction, this is the reason myself, as well as most other women, are diagnosed with Turner syndrome after infancy. These pictures are of my family and I. You can see the height comparison between my dad, mom, sister, and I. My sister and mom are both 5'9", and my dad is about 6'2", and I'm 5 foot. Gonadal dysgenesis, also known as ovarian dysfunction, is one of the other most common manifestations of Turner syndrome. Most patients will need to be given hormonal replacement, including estrogen pills and patches, to begin breast development and periods. For women, the importance of estrogen includes bone strength, along with several other benefits, such as protection of the heart. This part of this disorder is often the hardest for many to swallow, as it means that they will most likely not be able to have their own children. However, there is a chance that they could become pregnant with doctor assistance. Some go towards adoption if they want to have kids, while others go for in vitro fertilization, where a fertilized egg is inserted into the woman's uterus. However, that is generally not recommended because of the risk for dissection of the aorta, an often fatal event. Which leads us to the question, what heart issues plague Turner women? They are more susceptible to several different heart conditions. A bicuspid aortic valve, a valve with 2 leaflets instead of 3, occurs in 30 to 50% of all TS patients. Another common problem is aortic coarctation, or narrowing of the aorta, which often requires surgical repair. A cardiologist via echocardiography, or MRI, should evaluate every girl with TS periodically. For those whose initial evaluation is normal, imaging can be repeated every 5 to 10 years. If heart issues are found, a cardiologist will direct care. Pictured on this slide are several heart issues that could plague TS women. Pictured in the boxes on the side, so over here, are the abnormal bicuspid valve compared to the normal tricuspid valve. Aortic coarctation is also pictured. Other problems include aortic dissection, which is over on the other side, or a tear in the aorta, or aortic dilation, or widening of the aorta, which is in the bottom corner over there, and arterial hypertension, or high blood pressure, which is in the top. The kidneys of someone with Turner syndrome can also have structural malformations. These include problems with the collecting system, position, and vascular issues. This can cause a variety of other diseases, such as increased risk of hypertension and urinary tract infections. Newly diagnosed patients should have an ultrasound of their kidneys to make sure there are no abnormalities. These problems occur in approximately 1/3 of patients with TS. This over here is an example of a horseshoe kidney. Instead of the kidneys being separate, the kidneys are fused. And that's a problem that can occur. Patients with TS are at a greater risk for developing autoimmune diseases. Autoimmune diseases are something I know from personal experience with juvenile rheumatoid arthritis. This is just one example of an autoimmune disease patients may acquire. Others include celiac disease, thyroiditis or inflammation of the thyroid, inflammatory bowel disease, and several others. These conditions are treated as they are normally treated, through medicines, changed eating habits, and various different treatments. The endocrine system, or the hormone system, is one of the most important systems in understanding this disorder. The thyroid of many patients, including mine, are affected. Hypothyroidism, or lazy thyroid, is one of the most common thyroid disorders. Thyroid replacement hormones can be considered to fix this problem. Another disease associated with the endocrine system is diabetes of both type 1 and type 2 variety. Insulin and monitoring sugars would be the typical treatment for this disorder. Weight is another issue for females with Turner syndrome. Often they have increased BMIs or body mass indexes. This may be caused by a decreased metabolism. Exercising and eating right are ways to maintain the typical body mass. Often in women with TS, their bones are less dense than that of the normal female population. This increases the risk of fractures, which may be caused by a lack of estrogen and vitamin D. Estrogen treatment and vitamin D supplements are important for maintaining bone strength. Turner syndrome women are of average intelligence. However, they often have difficulties with math, nonverbal learning disorders, and visual spatial difficulties. TS women have higher susceptibility to have disorders such as attention deficit disorder, or ADD, and attention deficit hyperactivity disorder, or ADHD, which can cause problems for them in school. Often TS females are socially impaired. Neuropsychometric testing should be explored for all patients with Turner syndrome. The effective physical features of Turner syndrome are numerous. Along with short stature, features can include, but are not limited to, slightly outturned arms, low back hairline, extra skin on the neck, upturned nails, prominent, low-set ears, high arched strip of the mouth, small mouth, moles, puffy hands and feet at birth, broad chest, short for fingers and toes. Some TS patients have most of these features, while others have none. The senses are an important thing to the daily life of a human being. Some of the difficulties that can arise when one has this disorder pertaining to the ears and eyes are as follows. Conductive and sensory neural hearing loss are common in females with TS. Conductive hearing loss is common in childhood because of repeated ear infections. Sensory neural hearing loss shows up as one ages. TS girls are more susceptible to ear infections, and these infections should be treated vigorously. Assessments of the ear should be performed regularly, and hearing aids may eventually be needed. A TS female's eyes should be checked annually, as the following conditions could become present: strabismus, trouble getting the eyes to coordinate, amblyopia, or lazy eye, and ptosis, drooping of the eyelids. All of these conditions will be treated as they are normally, with glasses, contacts, surgery, or by other different means. Other issues include, but are not limited to, potential sleep apnea, or difficulty breathing while sleeping, liver problems, tumor formation, skin conditions, and numerous others. Those wondering how this affects the woman with Turner syndrome's employability, educational ability, and marital life can be referred to one study on Turner syndrome. This study found women with TS currently achieve education and employment levels higher than the female U.S. population, but are less likely to marry. In this study, they found that 70% of Turner women will achieve a bachelor's degree or higher, compared to 30% of U.S. women. When it came to jobs, 80% of Turner women were employed, compared to the U.S. female population at 70%. Notably, more Turner syndrome females were employed in healthcare and other helping fields than the U.S. female population. Although Turner women may be in higher education and more employed, compared to 78% of U.S. women, only 50% of TS women had ever been married. The lovely thing about having Turner syndrome is gaining a community of beautiful TS sisters. Hattie Frana is 17 years old, a junior at Southwind. Whenever we are together, we always seem to have a great time. Hattie is involved in most of the same activities that I am: speech, drama, chorus, golf, and is dedicated as I am to her education. Another great thing about Hattie is that she is only 4'10", so she makes me feel tall. Diamante is another wonderful TS sister that I have met over Facebook and Snapchat. I've never met her in person, but we Snapchat often. She lives in Chicago, but is from Lithuania, hence the super cool name. I'm sure you are wondering about my mentor experience. I mentored with Dr. Marcia Davenport, who is the professor of pediatrics in the Division of Endocrinology at the University of North Carolina at Chapel Hill. She's a pretty impressive woman. She has written many articles as well as a book that everyone who is diagnosed with Turner syndrome receives. I thought it was really awesome being able to meet someone of that caliber of knowledge and learn from her. She was an amazing resource for me throughout the duration of the project. I have mentioned little tidbits of it throughout the presentation, but now I'm sure you would like to hear about my own experience with this disease. I was diagnosed with juvenile rheumatoid arthritis at 14 months old. I went to Dr. Ann Reed at Mayo in Rochester for my arthritis in the summer of 2013, and she started questioning my height and referred me to an endocrinologist there to see what was going on. The endocrinologist then ran some blood tests and did some measurements of me and mentioned she thought I might have TS. She did a karyotype, and at the end of August 2013, I found out that I did, in fact, have TS. So then I got to have a whole bunch of fun tests of my heart, kidneys, and ears to make sure there were no problems. On the plus side, I got to watch Despicable Me while they looked at my heart, so that made it a little more bearable. But I do have to continue having the test for the rest of my life to make sure everything is all right. I also got a blood test to check out my thyroid and found out that I had hypothyroidism around that time as well. Since my mom learned that I may have some nonverbal learning issues and read up on them, she started to wonder if I didn't have some of those. So I went through 8 excruciating hours of neuropsychometric testing and neuropsychology just to find out what we already kind of figured. I have attention deficit disorder and have for years. I do not have to take any medicines for it because I have found ways around it. My TS story is by no means typical. Like I said before, each individual with TS is unique. So now when someone asks if someone knows someone with Turner syndrome or what Turner syndrome is, you will know what to say. I hope you gained some general information about Turner syndrome, but if you would like even more information about Turner syndrome, the Turner Syndrome Society website and Turner Syndrome Foundation website are great resources. To conclude my presentation today, I would like to show you a video about Turner syndrome. In the video, they say 1 in 2,500, but the correct statistic is 1 in 2,000. Just keep this in mind as you watch.
I'm just like anyone else, yet different than everyone else.
I am your friend,
Your sister,
your daughter, your granddaughter, your classmate,
your college student,
your neighbor, your teacher,
your caregiver,
your school counselor,
your flight attendant,
your nurse,
your programmer analyst,
your aunt, your judge, your volunteer.
I'm just like everybody else, yet different than everybody else.
I am 1 in every 2,500.
I take growth hormone.
I take estrogen.
I have lots of ear infections. I have extra skin on my neck.
I have a lot of moles.
I have learning difficulties. I will build my family through adoption.
I have many moles.
I have thyroid problems.
I have Crohn's.
I have cardiac issues.
I have low bone density.
I have kidney issues. I am a mosaic Turner. I have hearing aids.
I have Turner syndrome, and that's part of what makes me, me.
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 Me. Me. Me.
Me. Different than everyone else, yet the same as everyone else. How about you?
Thank you for listening to my presentation on Turner syndrome. Does anyone have any questions?
Plan on going into the medical field or healthcare?
I am actually planning on going into the medical field, but not as a geneticist or an endocrinologist, but actually as a child life specialist. As a child life specialist, I will go to hospitals and help children who are going through tough diagnoses at the beginning of their diagnosis and just help them deal with it and play with them and help them cope.
And what was that called?
Child life specialist.
With your mentor being so far away, what was your main point of contact for her?
I did a couple phone calls with her about my paper and my presentation, but most of our contact was through emails. I actually think I had 16 hours with her.
So Elizabeth, you mentioned child life specialists helping children with diagnoses. So this is a fairly recent diagnosis for you. I'm assuming it helped in some way, kind of knowing, putting a name to some things?
Yeah, because I haven't known for that long. I'm going through and learning all of this stuff, and I'm like, oh, yeah, I have that, or I do that, or different things that I've recognized.
Was it very frustrating prior to your diagnosis to understand what was going on?
Not really, because I've had arthritis since I was 14 months old. So we just kind of figured that I was short because of my arthritis, because that can stunt your growth. So we just figured it was because of that, but it turned out not to be because of that.
Did you have a child life specialist help you through the diagnosis?
No, I didn't actually, but at a camp I go to in the summer, I met a child life specialist, and she I watched her help a child go through learning how to swallow pills, and that really helped me understand what they do and learn to love it.
And what's the education involved in that position?
Only 4 years. So I'll be going to the University of Iowa next year.
What's the significance of the color you're wearing today?
Oh yeah, my presentation was purple, and what I'm wearing is purple because purple is the color for Turner syndrome. So, any other questions?
It was a very engaging presentation. I learned a lot from
I
it.
learned a lot. Oh, yeah.
Thank you.
Never having even heard of it.
Most people haven't.
And to have another one 20 miles down the road. with the
Yeah, it was
same-
really cool to meet her, and I've actually hung out with her many times. We went to a couple movies, and during speech we see her. And a lot of my friends have actually met her through speech and stuff.
She's awesome. There's another girl actually that she just met in speech from Jessup that also somewhere.
I couldn't get her permission to put her in the presentation, but
Another little weird fact that she just learned, her rheumatologist, Dr. Reed, started out at UNC, and then she was at Mayo, and now she's at Duke, and Dr. Davenport actually knows Dr. Reed.
that was really cool.
Yeah.
Yeah. Thank you.
Thank you.